I am the change. The APOPO program is first started with training the African giant rats to detect landmine, and has been in operation in several African countries, as well as Cambodia in Asia. For TB, we are training the African giant rat to detect pulmonary tuberculosis in humans as a second-line screening tool after hospitals have done TB screening with smear microscopy, which has less sensitivity and takes longer to diagnose. Then we test these samples with African giant rats. The initial research part started in the beginning of year 2001, but we started operation in 2007, 2008, and with the 4 dot centers. In 2016, we expanded to cover 28 collaborating hospitals, mainly in Dar es Salaam, with 3 in Morogoro and 1 in the coastal region. The support we have received from HDIF is particularly on establishing a new TB diagnostic center in Dar es Salaam. Why did we need this? In the initial strategy, I have said majority of the collaborating dot centers are in Dar es Salaam. So samples have to be shipped from Dar es Salaam to Morogoro and be tested in Morogoro, and the results be sent back to Dar es Salaam. The turnaround time have been 8 to 10 days. This is enough to lose a good number of additional patients that we find, because most of these have been already told by a hospital that they don't have TB. Then calling them back in 10 days or 14 days becomes difficult. So we saw the need to have a diagnostic facility in Dar es Salaam, which will be very close to the majority of the hospitals and could reduce the turnaround time from the 10 days time to 1 day, so that the patients, when they go to hospital, give sample number 1 the first day and come back to hospital on the 3rd day to get the results, they can also get the results from APOPO. We managed to recover by year 2015, 73% of the additional cases that we find per year came back to receive treatment. So the 27% is considered also very significant because they are human beings. So this HDIF project will enable us bring more people to start TB treatment. This project has combined all of these. We want to improve the case detection, we want to improve the patient tracking, and we want to improve the treatment adherence so that people who start TB treatment do as requiredly by the National TB Program. This has an advantage that if you follow the guideline, you adhere to treatment regimen, the likelihood of getting high rate of treatment success is higher. And we are going to use what we call e-compliance. It's a gadget, a tablet, and a fingerprint reader, which the healthcare workers will have, and each individual we find to be TB positive will put a fingerprint, and every time they take medicines, they'll put a fingerprint, so the health TB control team can monitor the treatment adherence.
These patients have to register themselves into the system using the fingerprint technology. Then we record these fingerprints, and they use these fingerprints for when they take their medicine on everyday basis or on alternate days. So basically that is the whole idea. So we make sure we follow up the patients daily to make sure they take their medicines. And the benefits, one of the good things highlighted into the system is that it's able to let you know if the patient has missed their doses, if they've taken up their dose on good time, and it is able also to detect other cases if they've completed medication, if they are cured, if probably they are hospitalized within their treatment when they're taking their medicine, or if by bad luck they die. So we'll have a whole database that tells us ideally the whole journey of the patient when they're taking their medication.
Panya wa APOPO ameweza kubadilisha maisha yangu kwa sababu ameweza kugundua ugonjwa wangu, na kipindi cha nyuma nilikuwa silali. Kaweza kunibadilisha, saizi nalala, napata usingizi. Mwanzoni nilikuwa nasikia maumivu na kohoa sana. Kwa hiyo saizi kabadilisha maisha yangu.
If remained undetected, can spread the disease to 10 up to 15 individuals per year. So this project will be very beneficial because the more people we get, the more people will get treated, the more people will be saved from contracting tuberculosis, and the less the government is going to spend on TB.
I think what makes it special is this combination of taking research, moving it into action, and seeing how a lab system can actually come around something unique like using rats for detection of TB. But combining that research with the lab testing, with the actual move into action and treatment is a very unique and special opportunity. So that's what we're really testing, is whether this type of solution is actually sustainable. So sometimes the innovation comes as a piece, the product, the service, a method, a way of doing business. But the question for that idea, that innovation to go forward, it requires a whole system. It requires a profit model. It requires a production method. It requires channel and distribution and brand. So what we're testing is, can APOPO and its partners, including the government, take this innovation by using rats to sniff the sputum, sniff TB and sputum, can they wrap around all those other solutions that make this a practical, scalable solution?